Welcome to Solo Pro Radio. It's the only resource for self-employed professionals to grow their business. I'm Barbara Saunders, the Solo Pro Success Coach, and it's my mission to help brilliant creative solo pros go from floundering to flourishing. And I do that as the director of the International Association of Self-Employed Communication Professionals and as the founder of the Solo Pro Academy, where I have programs focused specifically on helping solo pros build a profitable, custom-fit business. Swing on by soloprosuccess.com and pick up your free Income Accelerator Success Kit. If you'd like to join us, zip over to Solo Pro Radio on Facebook and like our page. You'll be able to ask questions, get to know our co-hosts, and find resources to help you connect and grow. So let's jump into today's topic. It's a real burning issue for a lot of solo pros. So I want to really welcome my guest today. Anthony Lopez is a small business specialist for ehealthinsurance.com. That's the leading online source of health insurance for individuals, families, and small businesses. eHealth Insurance presents complex health insurance information in an objective, user-friendly format, enabling the research, analysis, comparison, and purchase of health insurance products that best meet your needs. Anthony has over a decade of experience in the healthcare industry, health insurance industry. He's licensed in all 50 states and is a registered health underwriter. Anthony's going to talk about healthcare options for solo pros. And eHealth Insurance Services, Inc. is a leading online source of health insurance for individuals and families and small businesses. So that, I have to tell you, I've been to that site. I've bought health insurance through there, and it is really one of the best places to see what all is out there. So welcome, Anthony. Thanks so much for being with us.
It's my pleasure to be with you today.
This is such a complex and burning issue for a lot of solo pros. Tell us a little bit about what it is that you do.
Well, we shop for sole proprietors, individuals, as well as small businesses. We'll work with those people to walk through what their current plans are if they have health insurance, and really identify what they need in a plan or what their usage is of a health insurance plan, and then we'll shop for them across all of our carriers. And we actually have over 180 different carriers nationwide.
Really? It seems frustrating. We're here in Oregon, and I've learned that Oregon is one of the hardest states. Why is there so many different regulations across the states? What's up with that?
Well, health insurance is heavily regulated at the state level. Each state has their own Department of Insurance, and each state they're designing these regulations to control costs and expand the availability of coverage. And that's why you're seeing so many different regulations when you go from one state to the next. It's because they have their own state Department of Insurance.
Okay. And we talked a little earlier while we were offline about the Healthcare Reform Act. It's a little quiet now, but coming in 2 years, in 2014, there are some changes. Can you give us a little information on what's coming up in 2 years?
Yeah, absolutely. In 2014 is really when the healthcare reform is going to go into effect, where they'll have the individual mandate where everybody is required to purchase insurance. And they'll also have what's called guaranteed issue. So no longer will we have individuals that apply for insurance and are going to be declined. They'll be able to go out and shop for their plans that they need and be able to access care.
Interesting. So, I know a lot of people here, and of course, Oregon and Washington, I know are really difficult states, but are declined simply because they're women of a certain age. So you're saying that will go away, or?
Well, they won't. You can't decline somebody currently because of their age. They're going to take a look at their health history. So they'll look at and see if they've had a pre-existing condition in the past. And I'll use a heart attack as an example. Let's say somebody had a heart attack in the past 12 months. That could be a condition where the insurance company sees that as too high of a risk, and so they won't write that business on the individual plan.
Let's talk a little bit about, your health history when you're applying, and, are there date limitations? What really needs to be included and what doesn't?
Well, the insurance companies have done a really good job of putting together on their applications a series of health questions. And it's usually between 5 and 10 questions where they're going to capture all of the information that they need. And most of the time, they're looking back about 5 years. So as you're answering those questions, I'm sorry, go ahead.
No, it's interesting, just 5 years.
Yeah, they're really going to, they'll ask those specific questions, and you want to include as much information as possible. If it's a bigger condition, let's say something like cancer, they may have a 10-year look back, and that's where they'll capture all that information is going through those questions. They'll also ask you questions such as, have you been hospitalized in the last 12 months? And really, they're trying to identify if there's a big risk to take on that type of business or that individual. So they're asking the questions to drill down to what the pre-existing conditions are.
Right. So if you broke a leg or something, that's not as big a trigger as cancer, probably.
Absolutely. If somebody had broken a leg, let's say 2 years ago, that's probably not something that you're going to run into a big issue with because it's not a chronic condition. So there shouldn't be any ongoing treatment for that, unless it was a severe break, of course, and then physical therapy or something of that nature.
I've been intrigued I've seen some flags with people who had like TMJ, that jaw grinding, teeth grinding thing that were eliminated because of that. Is there, when I think of, leg breaking, I think of TMJ as not even as serious as that, and yet that seems to be more of a trigger. Are there things that maybe you should, I don't want to say not disclose, but maybe play down more, or you're probably not going to advocate that, are you?
No, yeah, I would definitely, encourage everybody to put as much detailed information as possible. And really what the insurance company is taking a look at is what the risk of that condition is and what the out-of-pocket expense is going to be moving forward. But you really do want to include as much information as possible so there's not a question, moving forward if everything was included on the application.
Okay, so would it be, with someone who has something like that, would it be more to their advantage to maybe work with someone like you or a broker rather than trying to fill out the forms themselves?
Yeah, absolutely. I think we can certainly help navigate through the health questionnaires and get them on the right track. There are always a lot of questions, especially in working with an individual that says, my child went to the doctor's last month just because they had a cold. And those type of situations aren't going to be something that you need to detail out. They're really looking for those major or chronic conditions.
That's a great point. I think a lot of us get a little scared when we're filling out those forms. If we don't disclose that we went, and got a prescription for a sinus infection or something, we'll be eliminated because we didn't tell them that. And, it's not really that big of an issue.
Yeah, and a lot of times it's not that big of an issue. It's really, it becomes an issue if somebody completes an application and they don't include their, the major items that they're going to the doctors for. And I'll use diabetes as an example.
Right.
If you leave that off of an application and you get your insurance plan in place and that very next month you're going in for all of the diabetic treatment, that's going to be a red flag that something wasn't included on the application that the insurance company didn't know.
That would be.
Yeah, and it does happen.
I was intrigued when we talked earlier. You had mentioned some "quote unquote" solo proprietor plans that are coming up in New York that are kind of really a great value, which I think would be very interesting to our listeners. Talk to us a little bit about those kind of plans.
Yeah, in the state of New York, they have a couple of different options. So you have your individual plans, you have your small business plans, and then they also have your sole proprietor plans, which the plans themselves are going to be designed just like an individual plan or a group health insurance plan, but the premium is going to be less than if you went through the individual market. And the reason is because those plans fall into the small business category. So it really is beneficial to the sole proprietor if they're able to to go that route as far as saving on their monthly premium.
Interesting. Now, how do those kind of compare to what we can find in individual plans in other states?
Well, the plans themselves are designed the same. So when you're talking about going to the doctor and having a copay, getting a prescription at a copay, all of the benefits are going to be they're going to be similar, or they're going to be alike. When you're looking at individual plans in any other state, you just really want to compare what the benefits are to you and what your utilization is of the plan. So if you're going to the doctors a lot, you probably are going to want to have a lower copay than having, let's say, a $40 or $50 copay each time you go to the doctor.
Yeah, that brings up another question to me. I know in plans that I've looked at, many times they include things that I'm not really interested. I don't have kids, so I don't really need well baby insurance or, neonatal care or that kind of a thing. I certainly rarely need a prostate exam.
Yeah.
And so I'm wondering if, all of those things seem to be included in the premium price. Is there a way to just get those things that you need? Or is that what you would work with someone like you with more to kind of put together your own plan? Or is that a possibility?
Well, there are some benefits that you're able to tailor to your specific needs. And then there are also going to be some benefits that are regulated either at the state level or the insurance company is requiring that they're part of the plan. So an example would be part of the new healthcare reform, preventative care has to be included on any plan. So going in for a well visit is going to be built into the health insurance plan. But we can control or take a look at what your deductible options are, whether or not you're going to have office visits at a copay, or you're going to pay towards your deductible, or if you'll have prescription coverage. And all of those are going to impact what your final premium is.
Interesting. And is it best to work with someone like you to kind of wrangle that kind of a deal rather than trying to do it on your own as an individual?
Yeah, absolutely. It doesn't cost the consumer anything to work with a broker. We work directly with the insurance company, and your price is going to be the same whether you come through eHealth Insurance and talk to Anthony or you go to one of the many insurance companies. But what we're able to do, and I have these conversations a lot where I'm walking through what the utilization is, and somebody may have a really low deductible, let's say a $250 deductible, but they don't use it that often. So you're really paying a lot in that premium to have a really low deductible. We can save you on your monthly premium and what your annual cost is going to be by increasing that deductible and maybe stripping some of the benefits or going with a higher copayment. Go from, let's say, a $25 to a $40 copay if you're only going a couple times a year when you get the cold.
Okay. What are some other little options or suggestions you have for people like that? That's actually sounds like a great kind of a way to think. What are some other little strategies that you might be able to suggest to our listeners?
Well, comparing the plans is the biggest. So regardless of what plan or carrier you're with now, I always encourage consumers to shop at least every year. Come out and take a look at the different options. You may have carrier A who was expensive last year, and this year their premiums may have dropped, or they're more competitive than they were the year before. And we can move you into a new plan, and you don't have to wait until there's not a contract period with health insurance. It's month to month. So if you bought a plan in August and you want to come and visit our website, we can navigate through all the different options and possibly find you a better carrier and plan and switch you for the month of February or March even.
Interesting. I did not know that you could switch that quickly.
Yeah,
There's
it's
not
a very
waiting
quick.
period?
There is not a waiting period. It's a very quick process, regardless of if you're on an individual plan, a group plan, or sole proprietor plan. They're all month-to-month plans. So most of the time, you're going to lock your premium in for a 12-month period. But we can change you from a carrier at any time and put you into if we find a plan that's better for you, we can move you right into that plan.
Interesting. That's a great tip, to just get in the habit of reviewing your health insurance every year. Is there a time of year that it's best to do that? I know, big companies have their open season. Sounds like they're going to go out and shoot somebody.
Bigger companies have their open enrollment period. Even the smaller companies will have their open enrollment period. But as far as shopping for health insurance on the sole proprietor or the individual market, anytime is a good time. You can view our site 24 hours a day, and we have over 200 licensed agents that can walk through the different benefits and the carriers and really help identify if you're on the right plan.
That's an interesting point, and I love, I have to tell you, I'm a confirmed online shopper. Totally. So I love this option that we have now to do this online. How did that come about? It's so totally different.
It is different. Our company's been in business for about 10 years, and we've grown over the years, obviously. And we work with all of these different insurance companies, and we love working with the consumers and really helping them out when they come to the website. That if they don't want to speak with an agent, they can actually complete their forms right online. It'll go to the insurance company, and they'll have their insurance usually on the 1st or the 15th of the very next month. But if they do need some help in navigating through the different plan options, that's where our agents really, come in, and we're able to help you out and navigate through all the different health insurance questions.
That's really great to know. Here's kind of an off-the-wall question, but do you find, because there's so much volume going on with your online option, that insurance companies are more willing to kind of work with you?
Well, we do have all of the major insurance. Well, we even have some of the smaller insurance companies. So I would have to say, yeah, they are willing to work with us. We work with the different insurance companies on the plans that they're offering on the website and making sure that we're really offering the best to the consumer, so they're able to see as many options as possible when they view the site. And I think the insurance companies appreciate that as well, because they really want to make sure that they're helping out the consumer and that as many people as possible have an insurance plan in place.
That's really a great service. I was, intrigued when I used your service to find my last health insurance plan, that we could compare a whole bunch of different things. And I have to admit, a lot of times I didn't know what I was comparing.
Yeah.
It is a little confusing. I was intrigued about, the health savings accounts. A couple years ago, there was this big ballyhoo about how great they were for individuals. Can you talk to us a little bit about those and what's going on with them now and how they relate to, I know it's the lower premium, higher deductible plans. What's going on in that ballpark?
Well, the health savings accounts are still a great option. And when working with individuals or sole proprietors, one of the very first questions I'll ask them is what their utilization has been over the last 12 months. And I actually work with my sister in putting her into a health savings account plan. And we took a look at, she just doesn't go to the doctors that often. She'll go for the annual exam. And every once in a while go in because she's not feeling well. So if you go to the doctors, you're going to pay everything out of pocket, and it's going to go towards satisfying your deductible. Along with satisfying your deductible, you also have your health savings account. So you can open up a health savings account directly through your own bank where you currently do your banking. And you can fund that on a monthly basis. You can put it all in one lump sum. And then when you go to the doctors, you'll have a debit card. You just slide your debit card, and it comes right out of that health savings account. The monthly premiums are generally going to be more affordable than if you go with a traditional plan that has an office visit copayment and prescriptions, all of the bells and whistles included in the health insurance plan. So a lot of times we can save significantly on the premium.
Now you're starting a firestorm of chats in the chat room. So some questions. I want to ask some of these questions. One, do all banks have HSAs? I know at the time when I had mine, I had to get it through State Farm.
No, but the majority of banks have them now. So if you go in and you let them know that you have that health insurance plan that's HSA eligible, they will be able to set you up with one of their health savings account through that establishment. But not all of them are going to have it. You want to check with your specific bank and make sure that they do offer it. Okay.
Do you know if the online banks are covering things like this now?
I haven't worked specifically with an online bank, but I would imagine that there are a lot of them that are out there that offer this in partnering with the health insurance company.
Interesting.
I haven't worked with any.
I know that. So your HSA is actually tied to your health insurance plan. Is it as easy then to change if you need to change to the next plan? So you have another plan.
Actually, it is easy. So your health savings account isn't necessarily tied to the actual health insurance plan, but you can't open up a health savings account plan without a health savings account eligible health insurance plan. So, and we work with clients all the time where they want to cancel their health insurance with company A and go to company B, and they can keep their health savings account. You can continue to use the money that you've put into that health savings account. You don't lose it. It rolls over from year to year. And even if you go onto a plan that's no longer HSA eligible, you can still use the funds that you've put into that account for doctor visits or anything that's going to be medically related.
That's really good to know. I was worried about that being tied to your plan. So that's great information. I have another question here on the chat room about buying, if you just want an emergency plan. Do HSAs work with those, what are they called, casualty plans or whatever?
Well, a lot of times when we are looking at a health savings account or, a high deductible health insurance option, that's what we would consider a major medical plan. Because if you're going to go to the doctors, let's say just for a regular sick visit, you'll be paying out of pocket and that'll go towards your deductible. So you're getting the reduced premium on a health savings account or even a high deductible plan because you're taking on more risk just in case you have an emergency or you have a major hospital stay.
That's interesting to know. Okay, so then you would be paying just for your regular, checkup or whatever, but if you got hit by a bus, then the insurance would kick in.
Once you satisfy your deductible, so you may have, let's say, a $2,500 deductible, your premiums are going to be lower than if you have, let's say, a $25 copayment if you go to the doctors or a $10 copayment for a generic drug.
Okay.
Every time you strip away one of those benefits, you're lowering your monthly cost.
Okay, so you kind of have to balance whether that benefit is really a value to you.
Absolutely.
Like the prostate exam just really isn't a whole lot of use to me.
Yeah, and now that's part of the preventative care. So on every health insurance plan, if it's part of your preventative screening, it's going to be covered at 100%. So that's going to be built into all plans now.
Interesting. Can you talk a little bit more about that? I think that we did not realize that. Talk a little bit more about the preventative.
Sure. Prior to the healthcare reform, there were different options. So you may go in for a preventative screening and go and, let's say, get some of your lab work done. And that lab work would be out of pocket and go towards your deductible. Okay. Now, anytime you go in and it's billed as a preventative exam, it's going to be covered at 100%.
Really?
That was something that was put in by the healthcare reform, and it's a mandated benefit. And that's really to encourage people to go in and make sure that they're having their preventative care taken care of, and it's not going to be a cost burden.
That's huge for a lot of self-employed people. I think maybe many of us did not know that.
Yeah, and that allows a lot of people that want to go with a higher deductible option, and they don't go to the doctors because they're sick. They just go in for their annual screenings.
Right.
You can still get your high deductible plan now and have your preventative care covered.
Yeah, that's really interesting. Tell me a little bit. Well, let me first take a station identification break. Let me remind our listeners that you're listening to Solo Pro Radio. I'm getting so into the conversation. I want to remind you where you are, listening to Solo Pro Radio on the Women for Women Network. I'm your host, Barbara, the Solo Pro Success Coach, and my guest today is Anthony Lopez of eHealthInsurance.com. Join in on the conversation in the chat room. That's just blazing down here. Or you can call in with Skype at W4WN Radio. or phone in at 561-422-4365. Let's jump back into our conversation, Anthony. I wanted to know about, we hear about HMO and PPO. We've heard about those, letters for so many years. What are they and how do they relate to what we're talking about here?
Well, a PPO is a plan that's going to give you the most freedom. So
Okay.
when I say freedom, it's really the freedom in selecting your doctor or seeing a specialist. As part of a PPO plan, you don't have a primary care physician. You can go to any doctor you want in their network. And if you want to see a specialist, you can make that appointment and go see that specialist as long as they're part of the network. You can also go outside of the network and see doctors who don't participate with that particular health insurance company, and you're still going to get it's going to be a reduced benefit, but you'll still get a benefit. An HMO plan is a health maintenance organization, and they really, you have what's called a gatekeeper or a primary care physician. And I'm actually on an HMO plan, so if I need to see a specialist or one of my children need to see a specialist, we'll go in and we'll see our doctor first. We'll go over what our symptoms are, and they'll give us the referral in order to see a specialist. So it's not as much freedom as a PPO plan, and because there's not as much freedom, a lot of times your HMO product is going to be more affordable than the PPO plan.
That's interesting. Let me ask, if you wouldn't mind sharing, why did you choose the one over the other personally?
Well, I don't go to the doctors that often, and I've been with an HMO probably going on 10 years now, and my oldest child is 17, and so my youngest is 8, and we've had nothing but a great experience with the doctors we have. We've never had a problem in getting a referral, and so I've never had a need to have a PPO plan or go outside of the network to see a doctor who doesn't participate.
That's interesting. Thanks for sharing that. Yeah, I have to be honest, our solo pro people tend to be blazing individualists. And the freedom is what we love. And that kind of brings me to another question. I don't know about the rest of the country, but here in the Northwest, we have a lot of options when it comes to alternative caregivers like naturopaths, acupuncturists, chiropractors, homeopathic. How does that fit with a PPO kind of a situation? If you prefer to see, maybe a naturopath as your primary physician, but maybe once in a while, you need to have your leg fixed for being hit by that bus.
Well, what's really important is checking with the insurance company before you go into that visit and making sure that it's going to be a covered benefit. So even if you're going outside of the network, you want to make sure that whatever you're being seen for is going to be covered. And as long as it's covered, even if you're seeing a doctor who's not part of the network, you'll get a reduced benefit, and they'll be able to help you out with some of the cost.
Okay. Do you find that insurance companies are more open to working with alternative caregivers now after the Healthcare Reform Act? Or?
Well, I'm not seeing a rise in those benefits. The more benefits that you add to any plan, the more expensive the monthly premium is going to be. So unfortunately, I'm just not seeing that there's a big increase since the healthcare reform, but I haven't seen any that have gone away, or I haven't seen any trends that it's something that they're not doing. Interesting.
So if someone were so disposed, would you then, as the consultant in this case, would you then, kind of lead them more towards that emergency plan?
I would take a look at the PPO options, and I would check and see if, the services that they're interested in are going to be a covered benefit. And if it's just not a covered benefit at all, then yeah, absolutely, I would steer them towards more of a high deductible plan, where they have coverage in case something major happens. Even if you get into a plan that has a $5,000 deductible,
right.
If you end up in the hospital for a couple of days, you can rack up, a bill of $50,000, $60,000, $70,000. And although $5,000 is a lot of money to anybody, it's a lot easier to manage than a bill that, let's say, is $75,000 or $100,000.
Right. It just depends on the mountain you're comparing it to, right?
Right. Yeah.
Well, let me ask you, we talked a little bit about HSOs. I remember hearing about like flexible spending accounts and things like that. Does that apply to individuals? Are there those options as well, or is the HSA take care of it?
The HSA takes care of it on the individual plans and the sole proprietor plans.
Okay. So your big suggestion might be, across the board, look into getting an HSA plan, maybe as a PPO situation for solo-based people, and then working with a consultant like you to kind of fine-tune?
Yeah, absolutely. And I'm sure there's a lot of people out there that their utilization, they do utilize the doctors or they have prescriptions. And in those instances, then an HSA might not be the right plan for them. Mm-hmm. We really take a look at the different options, regardless of what state it is, and find a plan that we can tailor to what their needs are.
That's interesting. We didn't talk anything. I'm not a big prescription person, so it didn't occur to me. But let's talk a little bit about prescription and drug coverage. I know that's a lot out there. What's going on with that, with the new healthcare reform? What are they doing to help those people who really need to manage those prescription and drug care situations? What are the changes there?
Well, I'm not seeing a lot of changes through the healthcare reform. As far as the health insurance plans, they do have, the generic, the brand name, and even the drugs that are called the non-formulary drugs, and those are the drugs that are not on the health insurance company's approved list. The insurance companies will still cover those drugs at a reduced benefit or even at a higher copay. And I've come across individuals that have prescriptions, that can be $400 or $500 a month, but they're able to get it at a copayment of $60. So we're really able to help a lot of people in that area and finding the right plan for them.
Interesting. Now, how does that relate to, we've heard a lot about Walmart having this prescription thing where you just pay everything, $4 for everything. What's the contrast there?
I have seen that Walmart plan, and actually that's a great plan that you can add to your health insurance. You can use that as an additional benefit, especially if you have a plan that, say, where your copayment is $10 for your generic. Well, if Walmart is going to have it for $4, then I would certainly take a look at adding that as an extra benefit. But they may not have all of the different brand name drugs that an insurance company is going to cover and give you at a reduced copayment. But they're certainly going to have a huge selection.
That's an excellent point, and it brings up another question. I've heard a lot of buzz about these healthcare discount plans now, where you have a code in a little card, and they offer like 70% off, LASIK surgery or whatever. What do you think about those discount plans?
Well, I think the discount plans serve a great purpose. They really do help individuals in reducing some of their health insurance costs or their dental and vision costs. What you need to be aware of, though, is what the limitations are on those plans. They're not regulated by the state, a lot of them, so they're not considered health insurance plans. So if you do have that big accident, you end up in the hospital or you end up in the emergency room, they may only have a $10,000 limit or a $5,000 limit on what they're going to cover. And then you're right back to square one where you're stuck with that big bill and you're looking for the health insurance plan to take care of it. So
it wouldn't be a standalone option at all?
No. When I'm working with, whether it be an individual or a group, it's not a product that I would say to replace health insurance. Definitely something that you may want to take a look at including with your health insurance plan, but never to replace it.
Interesting. Well, you mentioned two other things that we haven't talked about yet either, and that is vision and dental. Talk to us a little bit about that.
Well, vision and dental they're great. It's a great opportunity, a great plans to have as part of your health insurance option. The majority of us all go to the dentist at least twice a year. Mm-hmm. We should be getting our vision checked at least once a year. And not just to see if we need glasses, but also for health reasons. They can see if you possibly have diabetes. There's a lot of different benefits that you have from going to the dentist and going to see an eye doctor. And we can shop. We have just as many carriers on our dental and vision side as we do for our health insurance plan. And you can actually get those standalone. So if you're not able to get a health insurance plan at this time for whatever reason, you can still get yourself into a dental plan or pick up a vision plan so that you're able to seek those services and get everything taken care of there.
That's an excellent tip. I think a lot of us don't even think about, those either vision or dental. What are some of the options out there that people can look at?
Well, we have hundreds of options for your dental and vision, but when you're looking at the particular plans, I'll use vision as an example. Yeah. Just like health insurance, the more benefits that you have, the more your monthly premium is going to be. So you may want to pick up a plan if you wear glasses where you get your exam every 12 months, but you also want your frames and your lenses every 12 months. That's going to cost you a little bit more than if you pick up a plan where your exam is every 12 months, but your frames and lenses are every 24 months. And we really tailor that to the individual. So we would take a look and ask them what their usage is again and get them in the plan that's going to best fit them.
Well, here's a crazy question. This may be totally, out in left field, but you know how I have State Farm. I mentioned State Farm before. I have that for my house and my business and my car. Do plans say if you need, a health insurance and vision and dental, do they have those discounts where you get it all with one agent, you get 50% off or something?
No, health insurance is regulated by the state, so there's not a discount as far as health insurance goes. Okay. So it doesn't matter where you go or how you package the health insurance and the dental and the vision, the premium is all going to be the same. Now, if you do go to a particular carrier, they may have, let's say, $1 or $2 off your monthly premium if you bundle your health insurance, dental, and your vision all together. But you can't go to one particular agent and get a better price than the agent who is down the street. The cost will always be the same.
Okay, so that's interesting. So really, you manage costs more by maybe negotiating what's covered and what's not, rather than by shopping around by agent. Is that what I'm hearing you say?
Absolutely. Regardless of the agent that you go to, or if you go directly to the insurance company, because those costs are regulated by the state, as an agent, I'm not able to discount that cost. But what I can do is I can take a look at the different benefits and all of the plan options from all of the different insurance companies, and I can tailor a plan that's going to give you the best premium for the benefits that you're seeking. And because we have so many different carriers that we work with, we're able to find the best plan for the individual.
Interesting. I have a question here on the chat room that applies to this, and it's kind of making me wonder, we're talking about, okay, the costs are regulated, but you can negotiate the different things that are covered to kind of manage your costs personally. Is that what you're saying?
Well, it's not so much negotiating what the benefits are. The insurance company will have a portfolio of plans. So just use a round number, I'll say 25 plans. Some of those plans will have prescription coverage. They'll have a high deductible. They'll have a low copay. So I can navigate through those 25 plans with company A, but I'm also going to take a look at company B, C, and D and find the best plan from all of those different companies and all of those different options. So if you tell me, I just don't use prescriptions, it's not a benefit that I want to pay for, I'll go and look through all of those different carriers and all of those different plans until I find one that doesn't have that particular benefit included. And that'll help reduce the cost.
Oh, okay. So, one of the questions here on the chat room is, well, how do insurance companies compete then if everything's the same? So you're saying they actually compete with the variety of plans they offer. Is that right?
They do compete with the variety of plans that they offer. Now, the premiums are not going to be the same if you go from company A to company B. So they'll go through and they'll design their plans, and they'll submit those plans through their state department of insurance, and they'll get those premiums approved. The plans and the prices will not be the same from carrier to carrier, but when you go to an agent, we can't influence those premiums. So as a consultant, I'm not going to get paid, any more than the consultant down the street. I can't discount that plan for you, and I also can't put additional cost or fees into that health insurance premium.
Interesting. So the choice that we're making, really the comparison we're making, is what's in each individual plan. Is that how I'm understanding it?
Each individual plan as well as the carrier. So you'll have, let's say, 10 to 15 different carriers in a state, health insurance carriers. Those premiums are going to be different from each carrier. So you really have to see which one is the most competitive at any given time during the year. And then we can help you, and we can go through those different plan options or those different insurance carriers and find the best plan with the best carrier. And that'll change from year to year. So the company that has the best premium this year may not have the best premium next year.
Oh, so that's how they compete.
Yeah, they compete on a lot of different levels. A lot of times it'll be through the plans that they're offering, through the service, their customer service that they're giving when you're calling into the insurance company. If you're using an agent, the agent is certainly competing as far as what the customer service, how I'm treating my customers, what my turnaround time is, and getting back to you and helping you with all of your questions. Right. That's how we're able to compete and keep a lot of the business.
Well, I think that's huge, especially, solo pros, we tend to, I say wear a lot of different hats or have a lot of different voices going on in our head at the same time. We're trying to run our business and keep our lives going and, deal with taxes and the IRS. It is an extreme, help to have somebody to go to with all these questions because honestly, a lot of times it's just so confusing. Even when we try to compare them.
There is a lot to navigate through when you're looking at the health insurance plans. A website like eHealth Insurance is a great tool because you can compare them side by side. And if there's still questions, like I said, we have a lot of different agents, over 200 agents that can walk through these plans with you and really help you decipher what's going to be best for your individual need.
Well, excellent. We're getting down to the end of our hour here today. I want to thank you so much for joining us, Anthony. I want to remind our listeners to go visit ehealthinsurance.com. And Anthony, do you have any tips for maybe the newbie, the first time ehealthinsurance.com visitor? What should they do first to make their visit the easiest as possible?
Well, I would encourage them to contact an agent. So when you come to our website, it's really simple. It asks you for your zip code and your date of birth. And there will be an agent number, or you can even chat on the website. But get one of our agents on the line and just start asking them questions. They have a lot of experience, and they'll be able to help you navigate through all the different options. Okay.
So you can do it online, but you can also get some individual, personal, like somebody with a pulse.
Yeah, absolutely. And we'll be able to help you from start to finish all the way through when you get your ID cards, all the way until if you have a claims question or you need some help navigating through what your benefits are. So it doesn't stop with us just getting you a plan. We're really here to service you as long as you're a customer with eHealth Insurance.
Oh, that sounds great. So what would you suggest people have gathered when they come to the site? Do they need to have anything put together before they jump in?
Well, if they have their current plan, that would definitely help because we're going to compare what your current benefits are to the benefits that we have in your area. Maybe what your utilization is. How often do you go to the doctors? What type of prescriptions are you taking? These are all things that we're gonna compile, take a look at, and really start to shop the different options for you.
Excellent. Well, thank you so much for being with us today, Anthony. I really appreciate your sharing your knowledge and experience.
Thank you.
I want to remind our visitors it's ehealthinsurance.com. I want to also invite you to join me next week at Thursday, 1 p.m. Eastern Time, 10 a.m. Pacific, when my guest will be Gail Martin, the author of 30 Days to Online PR and Marketing Success. It was just published in November, and I've got that book, and it is fabulous. So join me next week. And I also want to remind you that I have an in-depth feast or famine cycle solution that you're going to love, and I'm going to share with you free. It's a brand new content-packed training call it's February the 8th at 6 p.m. It's called 3 Simple Steps to Break Free of the Feast and Famine Cycle for Solo Pros. You'll make more money, get higher paying clients, and streamline your business. You can reserve your seat at tinyurl.com/breakfree-call. That's tinyurl, tinyurl.com/breakfree, BREAKFREE-call. And it's a free visit. You can learn more about our upcoming shows at soloproradio.com. And if you'd like to learn how to attract and engage high-paying clients, swing by soloprosuccess.com and pick up my free Income Accelerator Success Kit. Finally, if you'd like to sponsor Solo Pro Radio and get extra visibility on our association site and in our weekly e-zine, the Solo Pro News, please contact Dean Piper at W4WN Radio by calling 561-506-4031, and he will set you up. Thanks so much for listening.